Hey guys, I am still in an airport. My flight got delayed, hence why I'm still wearing a mask. And I figured while I'm waiting, I'll talk to you guys a little bit about cancer, what a diagnosis of cancer means, and why your doctor may make recommendations to you about treating the cancer that are not what you expected. So first of all, we have to explain a few things about abnormal growths. You can have two kinds of abnormal growths. First of all, you can have benign growths, meaning that it's actually not cancer, it's just an abnormal growth of normal tissue in an area or a size that we would not expect. That means it's not cancer. In some cases, they may recommend surgery if it's causing some problems, but benign growth does not need chemotherapy. Then you'll have what we call malignant growths. Malignant growths are cancer. I like to remember the French word mal, which means bad, to help me remember that a malignant growth means cancer or a bad kind of growth. So once your doctor takes the tissue sample, then they will take the tissue to a special doctor called a pathologist. The pathologist will look at the tissue sample under a microscope to help them determine the level of abnormality. First of all, they will look at it to determine is it even cancer or is it benign growth? And then if it is abnormal, they'll look at what level of abnormality you have. They have what's called the grading system. I do not want to bore you guys with the details, but you can have slight abnormalities to extremely abnormal sample or abnormal findings of the same tissue sample. So I'll give you an example. For example, they might take a biopsy or a tissue sample from the skin and they'll look at it under the microscope and they'll say, okay, this is still skin cells, but they are extremely abnormal on a scale of 1 to 3. That's actually not the scale that they use, but I'm just giving an example. Say 3 is the worst. It's extremely abnormal from what we'd expect. Thereafter, they would, or in addition to that, they'd also look to see, is this even skin cells? Sometimes you can have cancer traveling from another organ, and that means the person has what we call metastatic cancer, or cancer that is not originating in that area. For example, you can have a brain tumor, but people might complain of bone pain. They see an abnormal growth in the bone, they take a tissue sample there, and they figure, oh, this is actually not bone tissue, this is brain tissue. And then you go backwards and figure out, oh, the person primarily has a brain tumor. So going to the next step, if they do find an abnormal growth, and they confirm it's malignant or cancer, then they look at the surrounding organs. First of all, they'll look at the surrounding lymph nodes. Lymph nodes are the cleaning system for organs. If the cancer has traveled there, then you know you're getting into the territory of what we call metastatic cancer. And they'll count how many lymph nodes are affected. The reason that this is important is if you have cancer spread to the lymph nodes, in that case you need chemotherapy. This is again a simplification. If you do not have cancer that has affected the lymph nodes, in most cases just doing surgery to take out the cancer is enough, and that can cure the cancer. Again, this is a general rule of thumb, but there are exceptions to this rule. For example, you can have a kind of lung cancer called small cell lung cancer, and it's in one part of the lung. The lymph nodes are not affected. The other parts of the body do not seem to have cancer, but this cancer is pretty aggressive. And in general, we assume if somebody has small cell lung cancer, it has spread in the bloodstream in a way that we cannot see. And that person will get chemotherapy to kill all the bad cells, even if we can't see them. And they may get what we call radiation therapy to the brain. That cancer likes to go to the brain to protect the brain from getting cancer spreading there. So after they look at the lymph nodes of an organ that's affected, they'll look at other tissues, and we tend to know the pattern based on the kind of cancer, the pattern of where it likes to spread. For example, I mentioned lung cancer, specifically small cell lung cancer, likes to go to the bones. It also likes to go to the brain. But another cancer, say breast cancer, might have a different pattern of spread. Breast cancer, if you imagine where, well, I shouldn't be saying that, but anyways, the breasts are on the front of the chest wall. Breast cancer can spread to the lymph nodes, which are in the armpits. And it can also spread to the lungs, which sit directly behind the breasts. It can also spread to other organs, but that's just a general pattern. So we'll do scans, targeted scans, specifically to look at places that the cancer commonly spreads. Thereafter, we'll go back and also look at the tissue sample and look at markers, what we call tumor markers, that the cancer might have. The interesting thing about these tumor markers is that there are many of them, they're more and more being discovered, but some tumor markers have certain medications or pills that kind of flip a switch off on those tumor cells, and they help kill the tumor cell specifically rather than killing all the cells in the body. Traditionally, for cancer, we used to give chemotherapy, and what chemotherapy is basically, I hate to say, to use this word, but it's almost like poison. Poison is not the right word, but it's like strong chemicals that are given to you by IV that kill fast-growing cells. That which cancer is. Cancer tends to be fast-growing and greedy, and take the blood supply and nutrients. But at the same time, you have other fast-growing cells in your body that are more likely to be affected by chemo. Specifically the hair, the eyelashes, and the intestines and the stomach, and the colon. So a common side effects of chemotherapy are people losing their hair, losing their eyelashes, having vomiting and diarrhea, because those cells in those areas are fast growing and the chemo's killing them. So that is an unfortunate side effect. When you are able to find pills that can kill that specific cancer, the rest of the body is not affected. For example, with breast cancer, common receptors are HER2 receptor or Herceptin receptor, PR, which is a progesterone receptor, and ER, which is an estrogen receptor. So when they take a tissue sample from the breast and they figure out, it has these receptors, there's specific pills rather than IV chemotherapy that the person can get that will kill the cancer only in that area and not affect the rest of the body. So going back to talking about cancer spreading, as a general rule of thumb, having cancer in one area is better than having cancer spread throughout the whole body. Let's see if we can, this guy will finish talking quickly so I can continue talking. Yeah, so as I was saying, he decides to talk more. Anyways, let's see if I can talk through this. So as I was saying, in general, it's better to have cancer in one area of the body rather than in multiple areas, but there are exceptions to this rule. Specifically, ovarian cancer and testicular cancer are usually found at a stage when they've metastasized. And the level of metastasis is what we call stage 4, or meaning it's spread not just to the lymph nodes, but to multiple other organs. Just because these kind of cancers have spread to multiple other organs, it doesn't mean that they cannot be cured. Testicular cancer can be cured by orchiectomy, meaning that they take out the testicle specifically, and sometimes giving chemotherapy. And after that, the person's cured, and they will follow up with their cancer doctor to make sure that the cancer doesn't come back. But in that case, it's cured. And then if you guys remember the example I was giving of small cell lung cancer, in that case, somebody might have a tumor just in the lung, and maybe the brain, but sometimes you might not. Say, I'll just keep it simple. Say they have a small cell tumor found in the lung. In that case, even though it's just at the lung, we assume that it is metastasized. And even though, in that case, even though it's only in the lung, we would not do surgery for that kind of cancer. We just assume it's metastatic. People with small cell lung cancer commonly get several kinds of chemotherapy. And from what I can remember, actually there are some pills that can target that kind of cancer. So on top of the chemotherapy, the radiation therapy to the brain, if the tissue sample is growing certain receptors that we have pills to kill, they will get that on top of the chemotherapy. So you can see that regimen is pretty taxing, having chemotherapy and having pills. I'm going to try to give another example. Say colon cancer. If you have colon cancer that's just in one part of the colon is the intestines. One part of the intestines, it hasn't spread very far. It's pretty superficial. They can just cut off that part of the intestine and they look at the lymph nodes. The lymph nodes are not affected. Other organs are not affected. They would have cure of their colon cancer. Again, all of this is oversimplification, but I just wanted to give you guys an idea as to what a diagnosis of cancer means. I wanted to emphasize the point that not all abnormal growths are cancer, and not all cancers are created equal. Even if it sounds like, it's pretty bad, depending on what abnormal growth they find, what level of abnormality, what level of spread, and what kind of medications your healthcare system offers, specifically pills that can kill the cancer, a diagnosis of cancer is not always terminal. I hope that was helpful. Take care. Bye-bye.